you can't be 6 feet apart or you're in a swimming pool. But if you can't be 6 feet apart, you need to have a mask on. Our gatherings remain capped at 50, and with face coverings and physical distancing. And I'll point out that the governor made note of some of the results they're getting from contact tracing that shows that family gatherings and other social gatherings have been a significant source of transmission. So this is not something totally new and not something that we didn't expect to find, but now you're getting data from the contact tracing that confirms that. So we continue to urge people to have the smallest social gatherings you have. Don't plan to invite 50 people over if you don't need to invite 50 people over. Keep the groups small, make sure that everybody keeps their masks on, and make sure that people are maintaining the physical distance from each other. Last week, Montgomery County Schools announced they would be online for the entire first semester. And while I wasn't directly involved in that decision, I support it. Yesterday, our county health officer recommended that private schools here not open for in-person instruction at the start of the school year, as it's not safe to do so from a public health perspective. And Dr. Gales and Dr. Stoddard will share more about their meeting during their remarks. My office sent over a proposal for $20 million from the CARES Act to expand county rental assistance. The council has passed that. We are well aware of the crisis that folks are facing in terms of rents. I want to remind people that there is an eviction defense, which the governor has kept in place, which is if you can demonstrate that you've lost income because of COVID, then that's a defense for not paying rent, and that's a defense against eviction. So even though eviction proceedings are going to proceed, and we're thinking the first of these cases will probably arrive at the end of August, people need to know that if they're out of work because of COVID, that is a totally legitimate defense. And it's a stopgap. Frankly, we need more money from the state and federal government to fix the problem on a more fundamental level. Landlords need rents ultimately to pay their lenders. So this is complicated, and we have to figure out how we get more money into the system to make sure that everybody can keep functioning. Tenants won't be very well protected if the landlords lose their housing in a repossession case for failure to pay the mortgage. So this is a time when we really need more cooperation and assistance from both the federal government and from the state government. We have reopened Montgomery Small Grants Business Program, so businesses are able to start applying for those grants now. We've given out millions of dollars so far in small business assistance. We've given out millions of dollars in assistance to individuals, and we're going to continue to be doing that. And I'll stop there.
Thank you, Mr. County Executive. Dr. Gales.
Good afternoon, everyone, and happy Thursday. I'm used to saying happy Wednesday. Before I start my remarks, I do want to make one observation. As part of the governor's announcement yesterday, he announced the retirement of Deputy Secretary Fran Phillips from the State Department of Health. Secretary Phillips has been my supervisor over the last year and a half or so. And before that, when I first came on as a health officer, she came out of retirement the first time to serve as acting health officer in Anne Arundel County. And one of the things that I did when I came on was reach out to health officers in other areas to learn from them and to see how they did things and to get their expertise. And she was one of those individuals who invited me over. We spent the day with her team going over how they work and what health officers should do and how they should function, whether it's the day-to-day role working with the state or balancing the nuances with the local jurisdiction elected officials. And from that very beginning and continuing through her time as the secretary, she was a close source of guidance, still will, calm, measured, thoughtful advice and guidance. And I just want to say personally, thank you, Fran, for your efforts for me as a supervisor, but then also the tremendous work and time that you have put in helping guide the state's response. And I'm confident at every turn that she represented the perspectives of from the public health perspective to the governor to the fullest. So thank you, Fran. I hope you enjoy your retirement. And even though I very much enjoy working with you, I hope you stick to it this time and enjoy the fruits of your labors. All right, now to pivot to where we are, as the county executive mentioned. So the state has seen an increase in numbers. That's it. I mean, there's no sugarcoating it, wordsmithing it, or twisting it around. We are at a point, the governor talked about it yesterday, being in the fork in the road. Some of us would argue that we've actually already gone down a path that is moving towards seeing increased numbers. And as a result, you've seen a number of jurisdictions take more restrictive actions. And we actually are reviewing our internal policies to see if there's anything we need to tweak or further adjust in terms of rolling back any provisions to keep our residents safe. Now, we will continue to monitor those, and as we move through those, we will announce those accordingly to the public. But I also want to make sure that people understand. So 3 weeks ago or so, we were talking about, the question was, when are we moving to phase 3? When are we moving to phase 3? Well, our realities have changed. And I know a lot of people continue to write in requesting other things be added and additional provisions be made. Right now, I want to emphasize to folks at home that even though it may not be your day-to-day reality in terms of being impacted by COVID-19, we're looking at the numbers across all of the residents of the county, across all of our zip codes, and looking at other jurisdictions within the state, the National Capital Region, and how we interface with other parts of the country. The numbers are going up. And so we need to make sure that we remain vigilant. We continue to wear our face coverings. We continue to practice the guidelines that we've put in place. And if those, once those numbers change, we can have more substantial conversations about reopening provisions and certain practices. I want to, and I would be remiss, I will stop and give room for questions, but in watching the funeral services of Congressman John Lewis this morning, I am reminded that there are many principles that are political. There's lots of things that we argue back and forth from a political perspective, but there are certain ones that should never be political, and we should follow them by looking at facts, data, and evidence. And health is one of those. And I want to just remind folks at home, there are decisions that we may make that you may not be happy with or may impact you in a way that's not beneficial. But we make these decisions, tough decisions, looking at the full constellation of the data and evidence that we have available. And we have to make decisions for all of the residents of the county, not one particular group, not one particular zip code, or not one particular part of society. So rest assured, our goal is always to keep our residents safe from a nonpartisan, apolitical manner. So thank you for your patience, and thank you for your continued adherence to the policies and the things that we've asked you to do to stay safe. Thank you.
Thank you, Dr. Gales. Dr. Stoddard.
Good afternoon. I have a few points before we get to questions. First off, personal protective equipment, we continue to do our distributions. We had done about a month-long distribution at the beginning of July, and so we had taken a couple weeks to sort of reassess our pool of PPE, acquire more PPE, and before we continue along with our distribution mechanisms, we began again this week. One key message we do want to get out there, though, is we are creating the expectation that those organizations that really struggled with PPE in the beginning of the year, particularly our nursing homes, assisted living facilities, childcare providers, really ought to be stocking up in the same way that the county is. The county is meant to be a backstop to providing, organizations who, for reasons that they could not control, couldn't access PPE. But right now, PPE is readily available, and we're expecting that our partners not be looking at the county necessarily as their first line of acquisition of PPE. They should be attempting to acquire and stockpile their own supplies, both for now and into the future, and looking to the county as a resource of last resort, as opposed to the first place you go for all of your PPE needs. We're trying to make sure we have a stockpile that will last us into beyond COVID-19 as well. And so we continue to do that. We work with our Board of Elections. Obviously, that's a big concern for us in November. We're making sure that we do planning to allow for election sites to be safe. Our Board of Elections is concerned that we're going to have as few as 1/3 of the normal number of election judges that we would normally have, given the number of people who have, basically described that they're either for health concerns or other concerns not willing to be election judges this year. That's a huge challenge for us, as is things like plexiglass and other accommodations to the sites to make them safer. We're working through all those issues. We'll likely have more to say about that as the summer goes on, but that is an area of active planning that we're engaged in right now. We had talked with both council and with you all about the testing expansion that we're working through. We did recruit volunteers from within county government and have thus far provided more than 120 volunteers to the Department of Health and Human Services from other places in county government to help support those testing efforts. That does not include 25 or so additional staff for the call center that will support those efforts as well. And so we're continuing to recruit additional support for those clinics, but obviously that's a substantial increase in the available resourcing for the scheduling of those clinics moving forward already. In addition, we, as it relates to enforcement education, we have added additional inspectors to the team for enforcement from other organizations. We also have, you likely saw a release that we sent out earlier this week from our Department of Permitting Services with regard to construction site enforcement that we will be doing more aggressively moving forward. We have seen a lot of construction sites that have been operating in manners not consistent with good public health practice. We're concerned about those frontline workers, many of them from our populations of color, our Latino community particularly as well. And obviously we do not want them to be in unsafe work conditions on those job sites. And so we're going to be doing some additional enforcement in those areas as well. One area that we've heard a lot of talk about this week is live performances. This is actually in the state order, this governor's order. Live performances, any live performance with an audience, and really the definition around the audience has been challenging from an attorney perspective because we struggle with defining exactly what an audience is. If you have a performance where people are sitting there eating their dinner, is that the same as an audience that comes to see a live event? And that's sort of where we've struggled with the enforcement piece, particularly as the understanding has been that the real intention of that order was to allow for live performances that were broadcast over Zoom or other digital media, but not to allow for concerts or other performances where people would be gathered. And so obviously we're doing some additional education with our breweries and other places, but in short, if there are people listening to a live performance, it's generally against the state order, with a few exceptions or sort of caveats that we're working through individually with different venues. The last thing I do want to highlight is we did have our Community Recovery Advisory Group meeting on Tuesday night. It was extremely well attended. We talked about the eviction prevention program and the dollars that council had appropriated that day and how we could utilize good racial equity and inclusion principles in how we both administered that program, but also how we get information out to our most vulnerable populations on how well how well that program will be received via different mechanisms of making people aware. And so we are going to modify some of our strategies from the first round of rental relief to incorporate better data on how we can focus on our zip codes of most concern, and we'll utilize better racial equity principles in how we roll out the program based on the feedback we do receive from that Community Recovery Advisory. The last thing I do want to say, and this is something that's come to our attention over the last couple of days, is we are hearing about some intended efforts to do graduation ceremonies. As we have previously discussed, graduation ceremonies do represent potential areas of risk. And obviously we have gathering guidance that limits gatherings up to 50 people. That would apply similarly to any kind of graduation ceremony as well. And so just to be very clear about that, and obviously if we find cases where there are those intending to do things beyond that, we will have conversations with them, because obviously that is not in harmony with the practice of good public health measures. And I'll stop there.
All right, thank you to all of you for those opening remarks. And we're going to begin today's questions with Chris Gordon from Channel 4, who has questions for both the county executive and Dr. Gales. Go ahead, Chris.
Sure. Let me just, am I off mute here?
Yes, you are.
Okay. And I'd like to pick up and ask Dr. Stoddard as well, because he just mentioned it. Good Counsel High School was just told that they have to cancel their graduation. They say that when the inspector showed up, they tried to discuss with him alternatives, shifts, having a 9, 11, a 3 p.m. graduation, breaking it down. And they said that he didn't want to hear anything. They say that the governor has encouraged, or again, weeks ago, and we know things change in days, let alone weeks, that they had been encouraging graduation, and that some other schools have had recently as this week and last week, some graduation. Is there any room for reconsideration on the Good Counsel High School graduation that I believe was just canceled and was scheduled for tomorrow, on Saturday? I'm sorry.
Hi, Chris, I'll just take a first stab at that. So let's be clear. We've been very open that if individuals or organizations are planning events, particularly those that we have been very clear about the restrictions and guidelines that have been put forward. In fact, our capacity limit has been in place for almost over a month at this point. And so we have asked groups to submit their plans and proposals. We've agreed to look at them and to see how we could potentially pull them off within the parameters that have been put into place to maximize safety for participants and residents of the county. When we don't have an opportunity to do that and events are moving forward, it's tough to be able to provide that guidance for an event when you aren't even notified about it and we happen to find out through a written complaint and concern. And so what we're asking is, if there are plans and ideas and things that are being put forward, to give us the opportunity to be able to provide input and to discuss potential alternative strategies such as shifts or other things like that, to be able to move the event forward in the spirit that it is there. Again, going back to my opening comments, we support the idea of trying to hold events and make events possible, because we recognize the spirit of them. But we also are very clear that there are rules and requirements and restrictions that are put in place, not because we arbitrarily want to do them, but because they're put into place from a public health perspective. And so I just want to make sure that people understand that we're not trying to be the boogeyman or bad police to come in and to shut things down, but they're practices that we have to adhere to. And if nothing else, even with the governor's announcement yesterday, we are in a situation right now where the numbers are not on our side. And so the idea of having large scale events with multiple hundreds of people in small enclosed spaces does not inspire confidence that we would be able to potentially mitigate any transmission should any cases happen.
I believe this was scheduled for a football field, though. I think this is an outside event.
Again, as I mentioned, we would need to actually have proposals. You actually know more about the event than we do. So again, that's the challenge, where we've been very clear for weeks now that we are open to working with agencies and groups to be able to try to stand up and successfully move forward events that support the spirit of the event, as well as are consistent with the safety guidelines, not only proposed here on a local jurisdiction, but also are respective and consistent with the guidelines put forward by the governor's office.
I would also note that if you look at the governor's contact tracing data that they released during the press conference yesterday, 21% of the cases are associated with outdoor gatherings. And so just because a gathering is outdoors does not make it automatically safe. And that's sort of why we have a restriction of total gathering size that is not shared around the state. And we firmly believe that's one of the reasons why our cases have not been as high as other jurisdictions in the state over recent days. And so I think that should be pretty clear that outdoor gatherings still pose a significant risk, as do large gatherings.
Okay. Thank you. Shanikia with WDVM has a question about cases. Are Are you still with us?
She's unmuted.
Mhm.
There we go.
All right, I'm unmuted. Thank you. This question is for Dr. Gales. I'm pretty sure you're about tired of hearing about phase 3, but I have to ask, what exactly has to happen? What do you need to see in order for us to get there?
Well, we've been very consistent. Again, going back to, I think it's been 3.5, 4 weeks. We've been hanging out in the phase 2 for a while. And, you know, from the beginning that we needed to see our numbers at that time had decreased to where we're talking about 50 to 60 cases a day. And now we're somewhere in that 70 to 80 range. So we've plateaued to some degree with a very slight uptick, not as significant as we have seen in other areas in Maryland, but at the same time, that does give us pause to be like, you know, how it's a precarious situation. So that said, we need to, in this setting, we need to see the numbers do a shift, not only for us, but for across the state, and see those numbers decrease to where we're talking about numbers of cases in the teens or, you know, 20s, and continuing to see other indicators go down. For example, where we stand right now, the indicators for those other metrics, such as hospitalization rate, rate of transmission, our numbers haven't jumped significantly, and we continue to watch those. But again, we need to see those daily case numbers continue to drop, the test positivity continue to drop. And again, the other challenge for us is that we are not in a bubble. And so we could be, you know, impacted by other jurisdictions that are close by if they see a significant increase. So for example, the Baltimore metro area has seen increases over the last 10 days. To some degree, Prince George's County, and even in DC, they've seen an increase in the cases over the last 7 to 10 days. So, and we know people move back and forth very seamlessly and easily. And so get our own numbers down, but also make sure that's in the context of numbers trending downward in neighboring jurisdictions as well.
Dr. Gales, stay right there. Brianna from Bethesda Beat has a question for both you and for Dr. Stoddard. Go ahead, Brianna.
Okay, great. Thank you for being here. I actually wanted to ask kind of the opposite of that question. I know that you mentioned that the Baltimore area, DC areas have seen higher cases. We're plateaued at about 70 to 80 new cases a day. Where would you see or expect to see case increases as far as pulling back on provisions and reinstating some restrictions? And I know you mentioned you guys are looking at the provisions. What specific provisions are you all looking at and would most likely be pulled back on if you have to reinstate some of those? And for Dr. Stoddard, how many businesses have been given warnings or citations for going against regulations, and how many have been shut down? Thanks.
So to your first question, in terms of numbers to roll back, I won't say go backwards, because we continue to make progress, is I think, you know, in the setting of a plateau, an extended plateau period where we're not seeing improvements, you know, continued improvements to drive further down. We know that it is, to borrow some phrase from some of the epidemiologists we work with, it's easier to drive it from 300 to 70 or 80. It's harder then to get that last bit down to drive it even further. And so I would say right now where we are is a point where we have to look at saying, you know, do we need to tighten some things up? And the other piece of that is going back to, again, we aren't in a bubble. And so we have to look at what's happening around us, particularly those jurisdictions that are close by. And so the significant increases in other parts of Maryland, as well as some, you know, slighter increases in the National Capital Region, is something that we would consider. I think that to an earlier question that was asked or mentioned in the governor's press conference yesterday, there were certain activities tied to the results of contact tracing. So we would look at potentially, you know, is there anything we need to do related to gathering size or the types of gatherings that allow? You know, also looking at the provisions when we're seeing a higher percentage tied to restaurant activity and bar activity, those kinds of things. So I think those are the types of things that we're going to look at. again, to evaluate the policy where we currently stand, to see if we need to change anything. And I would like to take this opportunity to highlight the efforts of members of the licensing and regulatory team, as well as the alcoholic beverage services team, who have been doing a fantastic job going through and ensuring that businesses are complying, and businesses, restaurants, and other entities are complying with those regulations. In fact, I know the governor has cited the Montgomery County team numerous times recently in terms of the work that they have done. So it's a full-fledged effort, but hopefully that addresses and answers the different components of your question.
Dr. Stoddard?
I'll add, Brianna, I'll provide you the specific answer, the specific numbers after the call. I don't have them in front of me. I don't want to give you something inaccurate, but in terms of businesses shut down, it's, I think it's 3 or fewer. And it's maybe a 10 to 12 citations issued, but I'll get you the exact numbers just because I don't want to be inaccurate there. The vast majority of businesses are complying or will educate them in a way that, they maybe have minor violations, but we will just educate them, and we, don't issue a citation in all cases where there's minor things. There are areas of improvement, for example. But I did want to echo what Dr. Yale said. The L&R team within HHS, the alcohol beverage services inspectors, and additionally the Department of Housing and Community Affairs, certainly early on with the ambassador program, and now Department of Permitting Services with construction sites particularly, have done incredibly good work. And I also want to credit the Montgomery County Police Department because they've been involved in the back end of enforcement as well. When we've had to take those few actions where we've shut down locations, they've been at great assistance as well. The vast majority of businesses are following the rules. Where we have seen problems, it is often in certain kinds of arenas, particularly because we're largely complaint driven. The education side is more proactive than the enforcement in terms of where we can be. We can't be everywhere in the county, and that's part of the challenge that we face. But those inspectors are working really, really hard and really, really long hours to try and be in as many places as they can be to answer questions and address concerns where they pop up. But I will provide you the data as a whole.
Thank you to all the reporters who have joined us and to our speakers today. We will next see you, barring anything unforeseen, we will next see you in August, and that will be month 5 of us joining you each week to make these subject matter experts in their various fields available for you to answer the COVID-19 questions that you may have and to share those with your communities, your audiences. And we appreciate you being here each week. We'll see you once again next Wednesday for our weekly briefing. Thanks so much.